Well, good afternoon. Welcome to Exceeds Expectations Health is Wealth series. We are going to be talking to Dr. Kenya Laser, and she's going to be sharing why chiropractic care is a tool for self-care. And so she's just going to enlighten us and make us aware of how important that, chiropractic care is just it is to our health. And a lot of times we just don't know. A lot of times we don't even know that, it's covered under our insurance. And so we're really just going to, or she's going to enlighten us on today. And Dr. Kenya, I would love to just say thank you for allowing us to interview you today. Absolutely. And we're looking forward to all you have to say.
Well, thank you for having me. Yeah, absolutely anything for you. But I own, my practice is called Laser Chiropractic, as you can see in the background. I own and operate it. The only doctor in here. I have a chiropractic assistant, Lauren. We're a family practice. I mean, we treat all walks of life here. Our youngest patient can be anywhere between like 2, I think we had 3 days old, and then our oldest is 87 right now. We do it all. Athletes. We love everyone.
So tell me, Dr. Laser, what made you go into this field? Why was it a passion or a goal of yours?
With my personality, really, I mean, I worked in the emergency rooms, as an ER tech. I was studying to become a physician assistant, so I needed my hours. I worked in nursing homes, hospitals, and I take on my patients' emotions. I take on that type of stuff. So I was very sick and sad all the time. When I was in that type of environment, I found chiropractic, and I just realized there's not too many professions that you can walk in the door in pain and sometimes the same day walk out of pain. And people smile when they walk through these doors, especially when they're having big breakthroughs and feeling better. It's a different health experience. So I just fell in love with it.
Awesome. I know that, hello, Grace. She's joining in today. Thanks for joining us. I know a lot of people have probably questions around what is the difference between physical therapy and chiropractic care? Is it the same, or is one better than the other, or would you recommend one over the other?
Honestly, we do a free consultation with everybody. We co-treat with physical therapists, their doctors, as well as we are. I would say the biggest difference is that chiropractors kind of focus on mastering the spine, the misalignments, the ailments. And physical therapists are doctors of movement, motion, restorative, things like that. Chiropractic does restore range of motion and movements, but I think those are the two big differences. Sometimes you can have a chiropractic case and not a physical therapist case, but most of the times we co-treat. I mean, I have a couple of physical therapists that I refer out to all the time. It's so good to have that synergy and collaboration with that, to not only, if someone has a 30-degree curve or a 10-degree curve in their spine, obviously that's a chiropractic case. But when you're restoring that motion, if there are muscle groups that need to be restored, those need to be co-treated with physical therapists, in my opinion.
Interesting. So tell us, when would you suggest one to come and see a chiropractor such as yourself? I know I've been following you, and you've been putting so much great knowledge on your social media pages, and I was just like, oh wow, I didn't know that you can also treat this to make sure that maybe something doesn't develop into something bigger. So can you tell us, what are some things that we can expect for you to help with when it comes to chiropractic care? Like, what things do you treat?
Absolutely. I love preventative care. So we treat a lot of families. So we don't start off, all families don't always just come in here with the knowledge of chiropractic can help them. Sometimes the children come with the mom because she's getting care, whether it's now she has neck and back pain from breastfeeding, or, the dad has the pain. So then we try and educate them on, all right, you have this 2-year-old here. Is he or she sliding down the stairs and falling and doing all, and we show them like, this is how we can help them. Or, we say, oh, you're more tense than you were yesterday. Like, what's going on? And they say, well, baby had us up all night. He or she isn't sleeping. And well, let's do an exam, see what's going on. Maybe it's, chiropractic can help with colic. It can help with ear infections, all those type of things. So that's kind of how we start the education process with people who aren't familiar with chiropractic care. But there's never, we treat the baby. We treat moms who are pregnant, before, all this craziness and chaos, parents would invite us to come and adjust the baby when the baby's just hours old, so there's no early time or late time to get checked. It's just get it as soon as you can, preventative care, get your spine checked because there's over 300,000 nerve fibers in our body and only about 10% or something like that is dedicated to pain. That's how it can help the digestion, the constipation, migraine, all those good things. So get your spine checked. We do a free consultation again, like I said, to just get your posture checked and see what's going on. Everybody's at home right now on the computer, on social media, doing all things. We're getting an influx of new patients that, are looking down and, sitting a little bit more. They have more time to realize, those things are bothering me. So I would just say, go to a good chiropractor and get checked.
That's so good. We have a question. It says, and that's from Tracy. How can you know if the baby needs that so early as an infant?
That baby will let you know. I think he was about 3 weeks. He came in a car seat and he was crying. I adjusted him in the car seat, checked his spine and his upper spine, adjusted him. That baby went to sleep just like that. I'm not saying that's all babies, but it'll squirm and cry. Get it checked for different things. We don't just do spinal checks. There's chiropractors that can see if your baby has an ear infection while they're there, if something else is going on, to send you to another spot. So, they have misalignments just like we have them.
Yeah.
And they actually respond. The adjustment to a baby is like checking the ripeness on a tomato. It's not very, tough at all. And sometimes they adjust themselves. They squirm and you'll see little movements and things. So yeah, I personally believe there's you can't get a baby checked too early. So.
Wow. Great question, Tracy. Thank you for bringing that up. And we're also going to hear from Takesha Boyd. She actually has a testimony about chiropractic care and probably even a question for you, Dr. Laser. And so, Takesha, can you just share, and this just came just out of nowhere. I was talking to Takesha. She's actually a friend of mine. And she was just like, yeah, my family had some issues when it came to spinal injury. So Takesha, can you share about that? And then we'll have Dr. Laser piggyback off of it.
Okay. Hi, Marilyn. First, I want to just thank you for having me today. Hi, Dr. Laser. Is it Laser?
Yeah.
How you doing today?
Good.
Good. So like Marilyn was saying, we were talking the other day, just in general, and she had brought up the show that she was going to have today. So I was just telling her, I was like, oh my God, I have been seeing a chiropractor. So what was it? 2019. I was shopping during Christmas time, and there was a young lady who was inside of Old Navy, and she approached me and she was asking if I wanted to get checked out by a chiropractor. So the funny thing is that my dad and all of his siblings, they suffer from spinal stenosis. And he had been telling me, hey, you need to get checked. So it was just kind of, one of those things where I'm like, okay, it was meant to be for me to run into her. So I signed up. I signed myself and my 2 kids up. I didn't sign my husband up because he's kind of, iffy about things like that. So when I went, the name of the practice is called Chiro One. They're really big in Illinois. They're really branching out. And so when I went in, they immediately took an X-ray of my spine, and they let me know where I was at. And I eventually started going. I think I would go like once a week to get checked get checked out, and they would give me certain care of what I needed to do. I would do certain exercises while I was there. He would crack my neck. He would do things with my back. The only thing that I didn't really like was the fact that they had told me that my girls, they would do an X-ray on my girls, and they did not do it, but they wanted to start treatment on them. So I wasn't big on that because, you still have to pay extra money. And my thing was, I wanted to kind of see where they were at prior to you starting care on them. But with me, I had lower back pain. They took care of that. My posture, I corrected that while going. And I really loved it. And everything worked out for me. But as far as my girls, I just kind of felt like, well, why not give them an X-ray so I could see where they were at? So I had a little just, confusion about that. So
how old are they?
I have a 9-year-old daughter, and then I have a 6-year-old daughter. And I did see younger kids come in. I think their earliest patient was 2 years of age.
Okay. So I usually, depending on how severe the case is, I usually take X-rays 8 on.
Okay.
So yeah, I feel I agree with you. Your 9-year-old should have had X-rays. I'm actually very surprised because I get a lot of pushback from not a lot, but I get some pushback from parents to say, hey, is this safe? Is this, and it's not it's not that much radiation, but especially like with my like bedwetting kids and things like that, I take an X-ray of, first of all, their entire spine, but I do look at their hips and sacrum and stuff. So yeah, we believe to see is to know, to not see is to guess. We just don't guess. We don't guess.
Right.
We look in there, we see what's going on, especially if you have some concerns about if there's family things going on. We definitely take care of that right away. It saves you money, saves us time getting straight to the results and just taking care of everybody the best we can. But spinal stenosis, putting as much blood flow, adjustments as early as possible, getting that motion to that spine, and getting as much nutrients and everything to that spine is the best, the earliest you can do it. So that's we went in and then got your kids in there.
Yeah.
That is
I'm sorry. Go ahead, Trees.
So that is so I go by. So yeah, my friend, she calls me Tree. So if y'all hear her say Trees, it's okay. We're just good friends, and she calls me by my middle name. But I was loving how you were sharing how your dad had encouraged you to go and get checked. And so what was it called that they diagnosed him with? And even I think you said another family member had it too.
Yeah, spinal stenosis. So it's
okay. That's what Dr. Laser said.
It's 8 siblings. So my dad has it, my uncle has it, and 2 of my aunts, and all 4 of them have had the operation. And then my cousin, who I just recently lost on Thursday, he actually had it. He had spinal stenosis. Yeah, he had it as well. So, but I don't have it. So that's the good thing. I checked out early. And I do need to go back, but I haven't been doing my exercises.
They will love you anyway. They want to see you. Go back.
I am.
Unconditional love. We don't care about that. Go back and start. Nobody's perfect. Nobody's perfect.
Right.
It's
Right.
not an overnight type thing. It's a progressive, long-term thing. So nobody expects you to just be perfect all of a sudden. So
Right. So I do have a question for you.
Okay, go ahead.
Dr. Laser. So I asked my pediatrician, well, they're a pediatrician, about them going. And she said that she only recommended it if they were having problems. So Kirsten, she's been swimming since the age of 2, but they've been out of swim since COVID. But she didn't knock it. She just said only if they're having problems. She just didn't recommend them going if there was no issues at all. So that was her biggest thing. So what do you prefer as far as kids? If I mean, I know it's preventative care, but if they're not having any issues, do you prefer that?
Honestly, it's the concern of the parent.
Okay.
If there's family history of things, why wait till those start?
Right.
Ahead of it? I treat a lot of patients that are not having any problems yet.
Okay.
Or are not, I, as my recommendation, I think everybody should get checked. I think that a maximum nervous system is the best thing. It's the master system of the body. So now why not have it working as optimal as it can all the time?
Right.
Yeah, I'm not, that's just my opinion.
Okay.
She or he is probably just protecting their patient. There's so many different branches of chiropractic care. They don't know this chiropractor from that chiropractor. You can walk next door to the next chiropractor. It could be an entirely different technique. We use a very gentle, specific technique here, get great results. Like I said, we use spray so that we're not just head to toe adjusting people. We find a spot, we adjust it, we take care of everything. So, but that's your pediatrician. That's their opinion, and I never tell anybody to go. She knows you the best. She knows your family the best. I think that trust there. Go with whatever you guys have going on. Yeah, I would never tell a patient not to do what their other doctors say.
Okay.
Right.
Okay.
So we have another question for you. We actually have 2. The first one is, what exercises can help for people sitting all day at a desk?
Ooh, let's see if I have that right here. I think it's in my so after I evaluate a patient and see what's going with them, I give them custom exercises. Even if you're sitting all day, your hips might not need certain exercises. I can give you some general exercises, Marilyn, to post on things just for like general sitting. But I like to just give a slew of things out there.
Right.
You're working the right muscle groups. You're doing certain, I like to know the person I'm giving the exercises to.
Right.
But yeah, I have different little tips, helpful hints that people can do while they're sitting at home all day. Get up, stretches, different little sleep positions that they can try if they're having neck pain. So I can give a couple of those to you so you can post on here.
Okay, awesome. And so, Tracy, I also say contact Dr. Laser so she can give you something personally.
I can definitely do that for you.
Yes. Okay, so we have another question. So Sydney, hi, Sydney. She says, for a first timer going to get chiropractic care, what can one expect for their first couple of visits?
Ooh, okay. That's a really good question. So for our office, we can send for the first day, we can send paperwork for you to have. That'll save you about 15 minutes on your first visit. If not, we'll have everything ready for you when you get here. So it'll take about 15 minutes for the intake paperwork. It's about quick family history and things like that. All of your concerns. Then I will do a complimentary consultation for you. I'll read over all your history, ask the appropriate questions. I really want to know what are your health goals? All right. If they're just to get out of pain as quick as possible because you're back at work here in about 2-3 weeks, or if they're a wellness plan. If you've been having these chronic issues for a long time, how can we get from point A to point B? Then I go ahead and I take the x-rays. I take the x-rays. I give you a gentle relief treatment the first day, very, very gentle. If I don't see any fractures or anything on the x-rays or any red flags. And then I'll take some time, usually that night, study the x-rays, mark them up with, see if you have a scoliosis. I present all that to you. So then the next day I can tell you what's wrong, what needs to be done, how long it's going to take, and then answer any questions you may have. And so I'll go over that the next day with you, and then we'll come to, treatment plan. I'll have a treatment plan ready for you. We agree with what's going on moving forward, and we just go right then.
There you go. So it does not sound bad, you guys. Look. So you can definitely count on the Chapel family coming to definitely get checked out this week. And so I know Bree, she's my daughter, if nobody knows, but she's excited just because, she plays sports, she plays volleyball. And so tell us, do you see a lot of people who play sports, coming into your business?
Yes. Well, yes. My husband coaches basketball. So yes, I do see a lot of them. I do see a difference between the male and female athletes. The boys, they grow so fast. So if they have a curve in their spine, one summer that can either go this way or that way, very positive or very negative. So if I do see that, I talk to the parents and I'll just let them know, hey, we need to keep an eye on this. I mean, those boys just grow so fast over like a couple months. So, but with the girls, again, we see a lot of lower back curves. Well, I do in this office, lower back scoliosis curves and a lot of period cramp type stuff. So we try and track that. But yeah, we treat all walks of life. So it's kind of an influx of things. This last 2 weeks has been a lot of the wives dragging their husbands in because they're tired of them complaining about their. So we've had like 5 new patients of just that.
Yeah,
I love
That's because a lot of times our husbands don't think that they need to come, but it's like they'll complain to us, but then they were like, but I don't want to go into the hospital, or I don't want to go into a chiropractor. I don't want to do that. Yeah. So yeah, this is so good. So Takesha, with your profession, do you have questions for Dr. Laser around chiropractic care?
I was just gonna raise my hand and ask you about that. Now, I've been a police officer for 18 and a half years now. So I actually started seeing a chiropractor probably 10 years ago because, we wear the large duty belt with the gun, the baton, and it adds on extra pounds on your waist. And so what I had started experiencing 10 years ago when I was a patrol officer, whenever I would get in and out of the car, the gun would rest kind of on my nerve. I'm a little curvy at the bottom. So my gun would rest kind of on my thigh. So it was causing, it was pressing on a nerve and it was causing numbness in the like upper part of my thigh. So once I started seeing a chiropractor, she took care of the issue. She told me to sit a certain way in the car. And then once I stopped being a patrolman, I bought a different weapon. So it's small, it's a Glock 26, so it's a lot smaller because what I do now, I extradite fugitives. So I travel in and out of the state. I'm on the plane a lot. So I bought a smaller weapon. So that really helped. So now what I'm experiencing, like I said, is more like lower back pain, but I think it's just because I work out a lot and I do a lot of different exercises. And I just think I just need to stay up on what I'm doing. But yeah, so do you see a lot of like firemen, construction workers, or police officers who wear the like lower duty belts? Do you see those people a lot?
Yes, I have some. I wouldn't say like a lot as far as the patient base, but I do have some, and it's one of those things where you can see on the X-ray, and then you can know their profession. You just know. You'll say, are you this or that or this? There's only a couple of things because the weight of the belt just pulls down. It just pulls you back. It pulls your hips. the just like crossing your leg. If you sit there and cross your legs for a long time, you get that numbness pain. So anything like that gun on your hip is going to pinch a nerve. And then it's a trauma, a repetitive thing. Anything you do consistently every single day, all the time, is going to have some type of repercussion, you know?
Right.
So yeah, the stepping out. You have
I'm sorry, what'd you say?
You have a good chiropractor. You do.
This is so good. So for men who have wallets in their pockets, you know, in their back pockets, and they're sitting on it all the time, you know, could that affect too? Can you speak to that?
Yes, so let's say it just misaligns your hip. You know, you're not supposed to sit on it because it's just like a mom or a woman hiking their hip up to hold a baby all the time. It just gets stuck like that. It works those similar muscles, maybe I'm trying not to say like paraspinal muscles or something like that. It's just repetitive, doing the same thing, and it only takes about, for example, on your sciatic nerve, it only takes about a weight of a dime to push on that nerve and cause that shooting pain down your leg or up your back or whatever it may be. So yes, sitting on your wallet is not good. If they have that little wallet mark in their back pocket, that's probably been there for years. So that's
you said that might be a sign that they need to see a chiropractor.
Yes, exactly. I should post that. That's definitely a chiropractor. Yeah, those Levi jeans with that little wallet.
Right. That imprint.
Yes.
Well, I know we don't have that much time, but I want to can you just share with us some symptoms, if one may have certain symptoms that it just might be a sign that they need to come see a chiropractor? Okay,
I'll share some. Like something, if you're having problem focusing, most people don't think. So most people think chiropractic, neck pain, back pain, migraines, headaches. We treat so much more than that. If you're just having a hard time focusing, anxiety is up, little different things. Another story, a mom brought her son in and she was like, you know, he had ADHD, and she's like, you know, can it help? She's seen the sign. I said, absolutely, bring him in. And as soon as he sat on the table, no one has ever asked him this. I said, put your hand on the area that gives you owies. Where does it hurt? And he put his hand right there on his neck, and he did this. So kids can't always tell us, I'm tense here. They don't know what that means. I hurt, you know. And so, you know, his focus went up because he wasn't in pain all the time. She came in, she brought him getting adjusted, and she reported, I don't know if this is related, but he's been paying attention just a little bit more. He can focus, he can do this. Yeah, because he's not in pain all the time, you know. So and like I said, anxiety, tension, just fogginess, forgetfulness, just aches, growing pains for kids. If their knees are hurting, most times it's their hips. So yeah, constipation, you know, just different little things.
Good. Thank you for that, for sharing that. I mean, it's because it's little stuff, right? And I mean, I know there was a lot that I didn't know. And so that's when I just knew that I needed to bring you on to, you know, interview you, to share with us, you know, what is chiropractic care, you know, and what does it entail? And, you know, how are you able to treat some of those symptoms? And especially because a lot of us have insurance. A lot of us will pay our insurance every month and we don't use it, you know, and you heard it from Dr. Laser. You heard it from even Takesha Boyd about preventative care, that chiropractic care is preventative care, because it can help you not experience something that might be detrimental to your life, right? And so if you could just, first I want to say thank you, Takesha, for coming on today, and as well as Dr. Laser. But Dr. Laser, I would like for you to share with us, how can we get in contact with you? How can we follow you? And whatever you want us to know before we leave today. I am so thankful for you.
Well, thank you. And it was nice meeting you, Takesha.
Nice meeting you.
A lot of people don't know this, but my name used to be Takenya.
Oh,
You changed it, but it was Takenya. So I like your name. But so if you, one thing I get really excited talking about chiropractic care. So I can kind of go everywhere. So if anybody has any question, you can post my email address and the number here. They can text any questions at all. If something wasn't clear, if they have any questions about chiropractic care, I have the time to answer it. You can follow me on Instagram or Facebook at Dr. Laser Chiropractic. And then you can check out our site and stuff and see there's some little things about x-rays and what we do here. So yeah, thank you. Thank you so much for having me. I was really nervous.
Good.
So you did amazing. Amazing. I hope a lot of people were enlightened, and I hope also that people were even enlightened about your story too, Takesha, and that it arose some questions. So Miss Tracy said, "Thanks, ladies. Thank you for joining us, Tracy." And that's it for today. So like Dr. Laser said, if you want to get in touch with her, we're going to make sure that we put all of her information still in the we're going to put it all still in the comments. So anywho, you guys have a great week. Be encouraged on this week, and remember that you have everything that you need in order to be successful. And so be encouraged. You guys have a great week.